I'm Dr. Rakesh Sringeri, one of the consultant gastroenterologist and hepatologist working at Kauvery Hospital, Electronic City, Bangalore. On 19th of April every year, we observe World Liver Day. I want to talk a little bit about a liver disease today. There are many causes that can affect the liver, but I'm going to focus on the three commonest causes: alcohol-related liver disease, viral hepatitis, and fatty liver disease. Fatty liver disease is currently booming worldwide, and it's going to be a pandemic in the future. Fatty liver disease is associated with other metabolic conditions like diabetes, high blood pressure, and high cholesterol. You're going to ask how the liver disease is going to progress. A healthy liver, when it's affected with any of the causes that I mentioned above, can lead to fatty infiltration or fatty liver. In some patients, this will progress to fibrosis, which eventually progress to advanced fibrosis leading to cirrhosis. Once the liver attains cirrhosis, it can develop chronic liver failure, gastrointestinal bleeding, including liver cancer as its complications. So how do we investigate these conditions? A lot of the time, patient doesn't have any symptoms related to liver disease. They usually have a blood test from a primary physician or have a scan for any other reason where they find out their liver tests are abnormal or there is fatty liver. Once they see a specialist, then we would advise some more investigation to identify any other causes for liver disease, and also we might consider some special scans like CT scan or MRI scan in selective cases. Lately, there has been another scan which we are all practicing called fibroscan or elastography, which will quantify how much fibrosis in the liver so that we could target our treatment in these patients who have advanced fibrosis. So how we can treat these conditions? As I mentioned earlier, it is all about addressing the risk factors. In patients with alcohol-related liver disease, they have to reduce their alcohol consumption with a view to achieve complete abstinence in the future so that they could minimize the progression of the liver disease. Patients with viral hepatitis will do special tests to identify what type of virus is affecting them. The commonest viruses are hepatitis B and C, which can lead to chronic liver disease. In the last decade, we have found many drugs to treat hepatitis C virus, and WHO aspires by 2030 we would be able to eradicate the hepatitis C virus worldwide. With the fatty liver disease, it is very important we address the risk factors. In patients with diabetes, they should aim for a better sugar control, and in patients with high blood pressure, we need to aim to maintain their blood pressure in the target range, and also patients with high cholesterol, we need to achieve better control of their lipids. By taking all these measures, we will be able to limit the progression of the liver disease. And in a fatty liver disease, it's very important we follow a healthy lifestyle with the diet modification where we follow a calorie deficit diet and as well as exercise with a view to at least exercise for 150 minutes a week. I hope this information is useful to all of you, and I aspire that we all aim to maintain a healthy liver going forwards.